Knock, knock, knock.
Come in.
All right, good morning. I am Pam. I'll be your nurse for today. Can I get your name, full name and date of birth?
It's Tara Lynch, 11/9/96.
All right, Tara. Excellent. First, I'm going to close this curtain here to provide us some privacy. And today, Tara, I will be performing on you an assessment of your abdomen. Is that okay with you?
Yes, ma'am.
Excellent. I have my stethoscope that I need for my exam, and then I have a gown here for you to put on. Excellent. So we're going to start, Tara, with you laying down or in the supine position. I'm going to pull this out for you, and I'll have you bend your knees for me. Excellent, to relax your abdominal muscles. I will begin this abdominal assessment with inspection. So I am going to, first of all, inspect the contour of her abdomen, and her abdomen is slightly rounded. I am looking for symmetry of her abdomen. Her abdomen is symmetrical. The color is appropriate and matches the rest of her skin tone. And also I am looking at the presence of any striae or any types of scars or lesions, and I do not visualize any at this time. Tara, can you point out your umbilicus for me? All right. So I'm looking at her umbilicus here, and the umbilicus is, the coloration is congruent with the rest of her skin intonation, and it is a slight innie, and it is symmetrical in midline and her belly here. I'm also going to look for any type of abnormal movements in your abdomen. I do see slight movement with respirations or with breathing, which is completely normal. I don't see any aortic pulsations or any heaves or any type of peristaltic movements at this time. So Tara, we're going to move right along to auscultating your abdomen here, and I'm going to start with the diaphragm side of my stethoscope, and I will be assessing for bowel sounds. So if you'll point out your umbilicus once more, and I want to make sure that I have the diaphragm side of my stethoscope. And Tara, I'm going to just listen in each quadrant for up to 5 minutes for bowel sounds. And I'm starting with the right lower quadrant here. Okay, I do hear bowel sounds. I'm going to move to the right upper quadrant. I do hear bowel sounds. I'll move to the left upper quadrant. I do hear bowel sounds. And then I'm going to move to the left lower quadrant. And I hear bowel sounds there as well. So Tara, I'm now going to move to the bell side of my stethoscope here. And we are going to listen for vascular sounds. I'm going to start, thank you, with the aorta. Okay. And I don't hear any bruits there. I'm going to start with the left renal artery. I don't hear any bruits there. The right renal artery. I don't hear any bruits there. Your left iliac artery. I don't hear any bruits there. And then to your right iliac artery. There are no bruits there. I'm going to come down to I'm going to listen to your femoral and your femoral artery on that side. And I do not hear any bruits there as well. Now I've completed inspection. I've done auscultation of all of her abdominal quadrants. Now I'm going to start in with percussion. Again, I'm going to start in the lower right quadrant here, and I'm just going to do sort of a zigzag pattern to make sure that I'm covering 3 spots in all areas of her abdomen here. I should hear like a light tympanic sound, as with my patient being in the supine position, air rises, and I should be able to hear tympani rather than dull sounds when I'm percussing. So, you ready, Tara?
Yes, ma'am.
All right, how you feeling?
All good.
All right, so I'm going to go ahead and percuss. pus here, 3 areas of the right lower quadrant. I'm gonna move on to 3 areas of the right upper quadrant. I've got nice tympanic sound going on here. Okay, I'm gonna move to the left upper quadrant. And then down to the left lower quadrant. And again, I'm hearing nice tympanic sounds. Excellent. All right, Tara, I'm going to move on to light palpation, and I'll be doing this using a single hand here. And again, I'm going to start in the right lower quadrant and touching on 3 spots in each quadrant here. Okay, might be a little bit uncomfortable here as I palpate the right lower quadrant. Okay, I'm feeling for the presence of any masses, any tenderness as I'm palpating, Tara? Okay, excellent. Again, I'm going in that zigzag pattern. Okay, and that's the right upper quadrant. I'm gonna move over to the left upper quadrant here. You okay?
Yes, ma'am.
Okay, get a little massage. And then lastly to the left lower quadrant. And I'm not palpating any masses, any swelling, any tenderness, any discomfort. Excellent. For deep palpation, you will be verbalizing this for your patient. And for deep palpation, I'm just going to use the 2-handed method, and I'm going to palpate in the same manner, going at a depth of 5 to 8 centimeters. And you will be verbalizing this. So I'm not going to push down on my patient, but I'm going to just demonstrate how I would do that in each quadrant. And remember, I'm going my zigzag pattern here. Any tenderness with that? No. All right, excellent, Tara. Love it. Okay, and you won't be pressing down on your patient as well as you're doing this. Left lower quadrant. All right, excellent. Deep palpation is done. Now I'm going to go ahead and palpate the aorta. So Tara, can you point to your umbilicus once again? I'm going to go up about 1 inch, over about 1 inch here to palpate her aorta. It should be between 2.5 and 4 centimeters, and I don't feel any abnormal pulsations or anything with her aorta there. All right, next I'm going to palpate your kidneys, Tara. So I'm just going to use a duckbill method here. I'm going to lift up her back here right along the lower costal border here in the back and sort of press here, duckbill, and I do not take a deep breath. All right. I did not note any change, any tenderness when I do that, Tara?
No, ma'am.
All righty. I'm going to palpate your kidney on the left side. It's slightly higher than on the right. Okay, any pain with that?
No, ma'am.
Alrighty, excellent, Tara. So everything seems to be okay with your kidneys. Next, I will assess Tara here for rebound tenderness, and that's done in the left lower quadrant. I'm just going to take my hand here in the left lower quadrant, and any tenderness when I do that?
No, ma'am.
Absolutely. Okay, good. Good job. Show me your umbilicus once again. Now we're going to assess McBurney's point. So I'm drawing an imaginary line from her umbilicus to her iliac crest here, and I'm going to go about 1/3 of the way up from the iliac crest, and I'm just going to palpate in that area. How are we doing there, Tara?
All good.
All right, so she is negative for the presence of peritonitis or appendicitis. Testing that. Next specialty test will be for Murphy's test. So for this one, I'm going to sort of have my patient relax, Tara. I will have you take a deep breath.
Gotcha.
And as you take that deep breath, I'm going to go in your upper right quadrant here under the costal border and sort of feel for that liver, okay?
Gotcha.
If she were to have pain or a sharp pain with this or any type of pain, that would indicate cholecystitis. All right. Tara, if you can just take a deep breath for me. I'm just going to tuck underneath that rib cage there. Any pain or tenderness?
No.
All right. So that was Murphy's test. All right, I'm gonna have you okay, Tara?
Yeah, I just hate doing that
Oh, I feel you on that one. Okay, so if you can go ahead and
Do you
sit
want
up
to
for
turn
me.
this way?
If you'll turn, yes, with your legs over this way, I am going to test Tara for CVA tenderness or cerebral costovertebral angle tenderness. So I'm going to just put my hand here right over her 12th rib and give it a good, any pain or tenderness with that? Excellent, that's total normal finding, which I'm expecting to see right along her 12th rib here. And once again, any pain with that?
No, ma'am.
Alrighty, Tara, it looks like I've completed your abdominal examination. I'm going to wash my hands here. The findings were completely normal, which I'm pleased to report. I will go ahead and
pleased to
document
hear.
those. Wonderful. Do you have any questions for me? All right, I'm going to document those findings and put those in the chart for your doctor.
Awesome.
Excellent.